Hi everyone, welcome to How to Create a Healthy General Plan. This is a recorded webinar being brought to you by ChangeLab Solutions, formerly Public Health Law and Policy. And we're really excited to be joined today by my colleague Lisa Chen, and also by two special guests who will be talking to us about some exciting planning efforts that are going on in Kern County here in California. So for today's webinar, we're going to talk about creating healthy general plans. And the agenda is to provide you with the tools and information you need to begin to plan for healthy communities where you work and live. My name is Heather Wooten. I'm a planner here at ChangeLab Solutions, and I'm going to be co-facilitating today's training along with my colleague Lisa Chen. And Lisa?
Hi, I'm Lisa Chen, and I'm also a planner here at ChangeLab Solutions. And I'm looking forward to our discussion today on how to integrate health into local planning processes.
Thanks, Lisa. I'm also really excited to have our special guest, Dr. Avtar Nijar-Sidhu here. And she's a community health capacity building specialist for the Kern County Department of Public Health, where she works at building the internal capacity of the Public Health Department to respond to our obesity epidemic through an initiative called the Central California Regional Obesity Prevention Program. It goes by the acronym CROP, and it's funded by the California Endowment. So hi, Avtar. Welcome. To get us started, I just thought I would ask you a question about what's your favorite outdoor activity in your community.
Good morning, Heather and Lisa. One of my favorite outdoor activities is when the weather's nice. I love playing in the park with my boys.
Oh, that's wonderful. And we're also very happy to be joined by John Asham. He's a president at GRC Associates, and he's actually been working to update the city of Arvin's general plan, which is a small town located in Kern County. And John, I'll ask you the same question. What's your favorite outdoor activity in your community?
Well, my favorite activity is cycling. I live near the Rose Bowl in Pasadena, and so there's a lot of activities, physical activities you can do there. One of them is they have a bicycle cycling lane in that area, so that's what I do.
Oh, that sounds wonderful, and definitely an activity that both Lisa and I enjoy as well. So the first section of our training today is to talk about what makes a healthy place. And this is just to provide a context and an overview to the idea of what a healthy community might look like. So the first image that I'm showing you here is a picture of a main street type intersection in a town. And I just want you to take a look at this image and imagine, what do you think some of the health consequences of living in a community like this might be? And I'm just going to put my co-presenter Lisa on the spot and ask her, Lisa, what do you think might be some of the health consequences of living in this community?
Well, I see tons of opportunities for physical activity. There's a great action shot in the right corner of a woman with a hula hoop, and lots of bikes parked and people riding them, people walking around. So it looks like there's a lot of physical activity opportunities. It looks like there's good sidewalks and trees and so on.
Yeah, and this is an image of a street that looks like it's been temporarily closed to traffic. So some of you may have heard of the idea of Sunday streets, or they go by different names. Sometimes cyclovia is another name that's used, and it's the idea where communities reclaim maybe a portion of their streets for play and physical activity and to build community. And Lisa, you pointed out a lot of great features here. You can see opportunities for safe physical activity. You can see the trees and the buildings create a pleasant place to be out and be active and be meeting your neighbors. Let's take a look at another image here. What do you think some of the health consequences of living in this community might be? You can see that in contrast to our previous image, we've got what isn't probably all too familiar scene for many of us who live in California or even around the country, where you have a sort of morning gridlock here. I don't know, Lisa, if anything jumps out to you.
Well, just the kind of sea of housing, it makes me wonder if people who are living there are able to walk to local stores, for example. I mean, in this picture, obviously, it seems like cars are the dominant way of getting around because of the perspective of the photo. But just with such a high density of housing and without any shopping centers or commercial corridors, it's hard to know if people have what they need at their fingertips.
Yeah, that's a great point. And I think a lot of the things that we that we talk about when we talk about communities that are really designed primarily for cars as the main way of getting around is that has a lot of consequences on our health. It has consequences in terms of some of the issues we talked about in the previous community with regards to physical activity and being able to walk and meet your daily needs, but other issues as well, like air and water quality, mental health, and social connectedness and quality of life are all impacted by communities' design. And we can see that design can have a positive effect on those aspects, or it can have a detrimental effect as well. So I want to introduce this concept of a healthy community. And when we're talking about how the built environment impacts health, we're not just talking about the health of individuals. So we're not just talking about, does this individual person smoke, or do you exercise? The built environment actually shapes health behaviors and outcomes. In other words, our health outcomes are actually impacted by the environment and the context in which we live and make individual choices. For many of you, this image here is probably jarring, although it wasn't that long ago that smoking was everywhere. In bars, workplaces, and public places, smoking was the norm. But we've had a series of public policy decisions that have changed this. So for example, in 1988, California voters passed our landmark Proposition 99, which increased our state cigarette tax by 25 cents per pack and earmarked the revenues largely for programs aimed at reducing smoking. And since then, California has been an international leader in reducing smoking rates. Between 1988 and 2005, California achieved a 38% reduction in adult smoking rates. We went from 22.7% to 14%, and now we're the second lowest smoking rate in the nation after Utah. So the goal of a social norm change approach is to indirectly influence current and potential future tobacco users by creating a social environment and a legal climate in which tobacco becomes less desirable, less accessible, and less acceptable. And this model is based on the idea that values, actions, and beliefs of individuals are actually tempered by their community, and that when we have shared norms of appropriate behavior, they're prescribed by everything from unspoken rules of etiquette to laws that are actually on the book. Social norms evolve along with organic changes in community and as the result of intentional human intervention. So the California Tobacco Control Program, which was funded by those Prop 99 dollars, was a deliberate effort to denormalize smoking and other tobacco use. So what does social norm change mean in the context of healthy planning? Well, before the automobile, communities had to be designed for the technology that was available, and that technology was walking primarily. Streetcar lines and other public transport also created walking opportunities, since the first and last segment of those trips from home or work was a walking trip. But as many of you probably know, after World War II and the growth in ownership of personal automobiles, the practice of community planning became more and more oriented towards designing communities for not for people, but in fact for cars. And this created a feedback loop. So the more we assumed people would drive, the more separated community uses became, and the more reliant we were on the automobile. So driving everywhere became this norm that we're talking about. This is actually a photo of Levittown, New York. It was the first of 4 master plan communities in the U.S. These communities were built with an eye towards efficiency, speed, and cost-effective construction. It was really new communities aimed towards the middle class. But it was also a racially homogeneous community that was known for its affordable but bland homes. And the 1948 model of the suburban community that you see here is still in evidence today. So this building that you see in the center of Levittown here is actually the community school, which is one change that I would say we probably have made from even this auto-oriented style community, where schools are no longer even located in the center of where people live. And what we see here is that now many communities around the country, a majority, are still predominantly low density, and they are also socially, economically, and architecturally homogeneous. And we see effects of those decisions around design, around investment in infrastructure, playing out in terms of the health consequences that we see in communities. So some of these things make instinctive sense, and I think when Lisa described some of the health effects that she imagined from the community images that we showed at the beginning, it just demonstrates the kind of instinctive connection people make between how communities look and how they imagine living in a community like that would affect their health. But we also are seeing an increasing body of evidence that supports in a very scientific way how these things play out. So for example, when we look at the obesity epidemic and we think about why people are consuming more calories, well, it turns out that things like the presence of convenience stores are associated with obesity. And if you ask, why are people less physically active in today's communities? It turns out that things like traffic hazards and poor intersections are associated with less physical activity. When people don't feel safe walking around in communities, they won't choose to walk. There's another important statistic here as well, which is that the number of miles traveled by motorized transportation is actually associated with obesity rates as well. And I think that's a kind of twofold outcome where you have people being less physically active because they're using their car to get around, but that's also time that they're not able to spend cooking a healthy meal or playing with their family or getting some physical activity. Of course, it's not all gloom and doom. I do want to note a very important thing here, and that is that we have adopted land use policies that support both this sprawling environment, this environment that promotes a lot of unhealthy food choices, but that land use policies can improve health as well. And the important thing to think about is that when we create community environments that promote health, in one area, let's say promoting obesity prevention, you can actually create multiple health beneficial outcomes. So for example, if you design communities that support walkability, you're also affecting, in addition to obesity, air quality, you're influencing traffic crashes, and you're influencing that social capital and mental health. So at this stage, I'm going to actually turn it over to my colleague Lisa, and she's going to walk us through some of the tools that we can use to create healthy general plans.
Great. Thanks so much for that wonderful introduction into the links between the built environment and health, Heather. We're now going to learn more about one type of local policy that a lot of communities in California and beyond have been using to really influence public health, and that is through the general planning process. Here is an overview of some of the opportunities to incorporate health during this planning process. Throughout our discussion, we'll be hearing from our guests about their own experiences, and we'll see some images from the planning process in Arvin, California that they participated in. Before we kick off, we just want to make sure that we're all on the same page here. So today we're talking about a particular type of planning policy, which is a general plan. General plans lay out the policies that determine sort of the priorities and the vision for how a community can grow and develop over time. And it includes policies for things like land use, that is the use of land for different types of commercial and residential and other mixed uses, housing, transportation, parks and open space, and other elements of a plan. And a general plan is kind of like the DNA of a community. A general plan that has solid health priorities can really improve a community's well-being for many decades into the future by guiding future policies, plans, and implementation strategies. These are often long-range documents that have a time horizon anywhere from a decade to 30 years. And another sort of quick refresher, we just wanted to highlight some of the actors who take place in making land use decisions. So in other words, we really want to highlight who is accountable for making sure that health is considered as part of a community planning agenda. To highlight just a few of these groups, there's of course the planning staff who implements the plans and policies, develops the new plans and policies, and oversees the development and implementation. But there are also the commissioners. These are they're appointed members of the community who advise the policymakers and direct the staff in making recommendations. And then of course there are the elected officials who are kind of the public face of the planning process. And they're really responsible for adopting the plans and policies, appointing the commissioners, and really kind of being the leaders for this process. And then of course we also wanted to highlight that everyone in this whole table are accountable to the electorate, the people in the community. So how can you ensure that health goals are reflected in your next general plan? Well, first let's take a look at what the update process looks like. So here is an overview of a generic planning process. The details may be slightly different in your community. As you can see, updating a general plan is a pretty complicated undertaking with a lot of different stakeholders and milestones along the way. Although the complexity of this process can seem daunting, one advantage is that there are lots of opportunities where people can get involved. We'll be talking a little bit about how to integrate health into each stage of this process, from the pre-plan project scoping through plan adoption and implementation. Okay, so getting started. Let's pretend that we're city planners in any town, USA, and we're just starting to think about our next general planning update. We're interested in making sure that our next plan has language which encourages healthy food retail, accessible parks and recreational spaces, and street improvements to make our city more walkable and bikeable. Where do we start? Well, even before the plan kicks off, we want to make sure that we don't overlook a very early stage, which is project scoping. You can even get a head start on introducing health in the general plan before the process officially begins. The Public Health Department in San Mateo County in Northern California was interested in doing just that. They put together a set of resources for their staff and for city planners on how to include health in land use planning. And this is language that they included in a request for proposals meant to recruit consultants to prepare a plan. This is just one example of the kind of pre-work that will make getting the plan you want much easier. San Mateo County has outlined the issues that they'll be looking for. This might vary from place to place, of course. Note that San Mateo County doesn't specify exactly how to include health in the plan. They leave that up to the consultant to propose. This is the kind of flexibility that can be a really good thing because it will encourage applicants to think about creative ways to approach the problem. And here's just one more tool that they developed. This is a sample question for an interview with a consultant candidate, and the tool even includes what to look for in a response. Notice that San Mateo County emphasized the idea of using planning to start a dialogue around health. We think this is really critical. Stakeholders will have many diverse ideas for how to make their environment more healthy, and starting a conversation amongst these groups is the first step to defining what the community's health priorities are. An additional benefit of this kind of early framing is that you can be sure that health is part of the budget, or part of the project from the beginning, and that it's included in the costing out and in the recruitment phases and so on and so forth. And in addition to planning consultants, it's important to keep in mind the other stakeholder groups who are actively involved in the early planning stages. We just want to highlight a few of these key stakeholders who can help make sure that health is on the agenda from the beginning. So these include, for example, the General Plan Advisory Committee, which provides the overall vision for health in the general plan. The Community Outreach Team, which is really responsible for making sure that there are a lot of different voices during this process. The Technical Advisory Committee is another group that also really shapes the perception of health by making sure that there's health data that's included in the planning process. It's important to note that cities often have different names for these groups, but in general they will have stakeholders who perform each of these functions. So that was kind of a brief overview of the pre-planning stages, the scoping phase. We're now going to turn to our guests. We're so pleased to have people on the call here who really have experience with this process on the ground. So we're going to be hearing from Dr. Avtar and from John. And I have a couple of questions just to kind of get the ball rolling, but please feel free to chime in if anything else comes to mind on the idea of project scoping and including health during that process. So Avtar, we're going to hear from you first.
Okay.
I have a question. So, hello.
Yes, I'm here.
Great. So my question for you is, what do you see as the role of health professionals during the initial stages of the planning process?
The more I learn about land use and planning, the more I realize that health and planning really are from the same world. And so I think it's trying to engage health professionals to understand that when we talk about planning, it very much is integral to what we do in health.
Great. John, did you want to speak to that comment?
Well, I think in terms of scoping, the health element itself, in the city of Arvin, where we're doing the general plan update, we are preparing individual health element. Now, the health element is not one of the mandatory elements required for a general plan. So fortunately for the city of Arvin, they were able to receive funding through grants to develop this as an optional element to the general plan. And in other cities where they may not have a separate housing element, there are, you have your other elements that all have an impact. Parts of the element have components that impact health, for example, circulation and land use. And so it's important to include those and those parts of the element as well, and really follow some of the principles of sustainable communities, which include like walkable neighborhoods and mixed uses and compact designs. Basically, all revolves around getting people out of the car. So.
Great, thank you, John. And then just a follow-up question for Avtar or John. Kind of during this initial phase where the idea of the idea of inserting health into the general plan is very new, and as you just mentioned, John, it's not a required element of general plans. What sorts of data or information can people really use to help make the case that this is something that is important to include?
Oh, okay. I think it's really important to really start early on your community outreach effort. Mm-hmm. I think that in that way you can sort of focus your energies on specific parts that are really relevant to your community. There's a lot of data that's out there on sort of the county public health and sort of region-wide areas, but for your specific community, it's really important to touch on or find out exactly what are some of the key issues that are concerning the people. So it's important to start that out at the very beginning.
Mm-hmm. Great, thank you. So we'll be switching gears now to the next phase, which is community engagement. That was a great segue.
Thanks, Lisa. That was a perfect segue. So it's time to talk about our next step, which, as Lisa mentioned, is about community engagement. So collaborative partnerships that involve community stakeholders have been key to developing and implementing healthy planning policies, and I think that's something that John just emphasized. Healthy planning actually can bring new stakeholders to the planning table. So that can include public health departments, which is a group that Avtar represents. It can include residents, schools, hospitals, businesses, and local government agencies like community development and planning, of course, but also parks and recreation, traffic engineering, and other groups. So I want to give one example from a community that has recently updated their general plan. And they have an interesting story. So this is a story about the city of Southgate. They have about 100,000 residents in about 7.5 square miles. And it's a city with a very young and majority Latino population, about 94% Latino. They also are dealing with high levels of poverty and some of the highest obesity and diabetes rates in the country. With these statistics, the community knew that they really wanted to focus on including health in their general plan update. So they pulled together a project team that included a number of partners. They had a consultant who was the lead in terms of actually developing the plan, and that was the firm Ramey & Associates. They also had the LA County Health Department. They had a staff person who was actively participating in the plan update. They had a community-based organization, the Transportation and Land Use Collaborative, who led the community outreach. ChangeLab Solutions actually participated as a technical advisor. And they also, of course, had the city of Southgate, and each had a role in the community engagement process. So, for example, the health department actually went to community workshops and presented local health data in a very clear and simple format. The community-based organization led the outreach component. They also put together the workshop design, they facilitated it, and they followed up. The consultant actually led a lot of the technical aspects of plan development. So they produced maps, they actually wrote the plan's policies. They also supported the workshop through facilitation. And ChangeLab Solutions helped present at workshops and help translate resident priorities into policy language. And then the city is tasked with ongoing implementation. So here's actually a quote from one of the Los Angeles County Public Health staff who participated in the plan update. She said she was amazed at how invested attendees were in their community and by the practical ideas they offered. She said she didn't need to say much. The residents brought up the needs to have safe places to walk, to be able to get out of their cars, and to have safe parks. The health department's involvement gave added momentum and credibility for addressing the health of their community more comprehensively in Southgate and by creating what turned out to be a standalone health element. But you know, informal relationship building works with community engagement as well, and personal relationships sustain this work over time. It shouldn't be a surprise to any of you out there that developing and implementing plans can take a very long time, but the payoff is that you're able to create a lasting impact in your community. So now I want to ask John and Avtar a few questions about community engagement and their own experience in this area. So John, let's start with you. What lessons did you learn from the community engagement process in Arvin in terms of thinking about how health could influence the plan?
Well, first of all, we've had 2 community meetings. One was an overall community meeting where we had about 60 participants involved in that. And then the second was a design charrette that we also had that looked at development of 2 specific sites within the city. But in terms of our community meeting, the most important thing on that is to get the message out, which is basically Community Outreach 101. And we were fortunate enough to get 2 organizations who were part of the team to emphasize or to focus on that area, to get the message out through flyers and going to community meetings, separate meetings, for example, churches and the schools, and that to get that information out, to attend the community meeting, as well as sort of discuss the whole process. One of the important things that we were fortunate enough is that through our advisory committee, we had the superintendent of schools involved. And through her, we were able to get the elementary schools involved through having students draw pictures of healthy activities within their city and what they want to see in their community. And from those drawings, we're now collecting them and being able to maybe develop some policies and action programs to fund that. We also had the high school and some of the students involved in that, involved in that charrette, where they helped do a tour of the community and emphasizing certain areas of the city that required some improvements. Really, the students really know the community almost better than anybody else because they are the ones who walk to and from schools. And so one of the key information that came out was that pedestrian safety or safe access to schools. And then I guess another component is getting the business community involved, and especially the Chamber of Commerce and meeting with some of the convenience store owners on a one-to-one basis.
Thanks, John. Those are really great tips and techniques for engaging youth, which is another stakeholder group that planning maybe hasn't traditionally been so wonderful at doing outreach with, but it sounds like you guys came up with some creative strategies and activities to help them describe their community in their own words or with their own images. Avtar, I want to ask you a question next. So if we're successful at bringing community residents to our workshops and engaging them and getting their feedback, what are your tips for actually communicating the policy process to residents and keeping them engaged, since we know this is a time-consuming process, not even to develop the plan, but also to see it implemented?
So what works best is when people can see policies that are very tangible. So I use examples from public health when we talk about a car seat policy. Like, for example, the Public Health Department, if you qualify based on income levels and if you qualify based on if you have a child, you're eligible to receive a car seat for your infant or for your child. But for the rest of us who don't have children of that age or that income level, that program wouldn't apply to us. But now in the state of California, everybody has to wear a seatbelt, right? It's a policy. Now it applies to all of us. People can understand it better when we're able to show how public health works in policies that apply for everybody. Just like with the smoking cessation programs, what state of California started 20 years ago. There was a time when you could smoke in restaurants or a time when you could smoke on an airplane. And now there's a whole new generation who doesn't even remember that, but the older ones do, and they realize when we show it to them examples how policies in time have really affected to improve the overall environment or the health of a community.
Yeah, thanks, Avatar. That example I think is really interesting because as you mentioned, for somebody who has never had the experience of walking into a workplace or walking into a restaurant and having almost everyone smoking, it might seem kind of impossible to imagine that that change could happen over even one generation in California. And I think there's a really similar analogy there in terms of how we design our communities. And if you think about either the community where you live that's not walkable or the community where you live that is dealing with a lot of air pollution, it can be really difficult to imagine what that future looks like. But painting those pictures and showing that it is possible, I think, is one way to keep people engaged in a policymaking process over time. So thank you for that. At this point, I'm going to turn it back over to Lisa, and she's going to talk a little bit more about data collection.
Great, thank you. And thank you to Avatar and John for those really wonderful examples. In particular, this next topic is relevant to what John was mentioning about engaging people in kind of outlining what some of the health challenges and opportunities are in the community. As we know, people really love data, and it can be very compelling during a planning or other policy process. And this is actually an area where it's really great to have the local public health department on board to see if there are opportunities to collaborate and share data, and really just to have conversations about what the health challenges are in the community. Oftentimes, health departments can provide data during the planning process that is quite different from what a planning department would normally gather. So here is just one example. I'm going to show a few different examples of data and how it can be used during the planning process, and then we'll hear again about ways that John and Avatar have seen this done. But here is a map from the city of Ventura, California, where they actually used a pretty detailed and innovative process in order to assess walkability. So the circles on the screen show kind of a walk shed. So we know that in kind of the planning best practices that people often will walk a maximum of a quarter mile to get to stores or to transit hubs and so on and so forth. And then a half mile is kind of the outer range of that. So what they did was they actually drew a quarter mile and a half mile buffer around a transit stop. And then they did an additional analysis where they said, okay, what are some of the barriers in this environment? Is there a freeway that they have to cross under? Are there streets that have a lot of impediments such as heavy traffic or a lack of crosswalks? And then they actually created this additional layer which shows the actual walkability for a 5-minute and a 10-minute walk score. Now, an area where planners have not traditionally collected much data is actually in the realm of food resources in a community. This is for a variety of reasons, but in particular, food is an area that is often overlooked in general planning processes. So here's an example from the Washington, D.C. Planning Office, where they've actually mapped out the full-service grocery stores in their community and created, again, these walk buffers around each of them, modeling a 5-minute, 10-minute, and 15-minute walk. And then the areas that don't have these green circles around them are actually areas that do not have easy access to grocery stores. So this kind of map lets policymakers, planners, and stakeholders really get a picture of who has access to grocery stores in their community and which areas are really the most underserved and ripe for investment. And we love seeing things in maps like this because it really helps people kind of visualize where those spots are in their community. But here's another way of seeing that same data where it's arranged by ward. So this is really kind of hitting home, the idea of getting engaged in sort of the policy process and figuring out which are the areas that we should prioritize investment in, and then who are the elected officials who are accountable for those areas. And then, of course, we want to just emphasize that data is really great, but you really don't need fancy statistical models or sophisticated mapping software in order to make an effective health argument. So your knowledge from your daily practice can really be just as persuasive. It's important to remember that politically valid data is different from scientifically valid data. That is, sometimes even the simple data can really have a big impact on the way people think about policy. So with that, I want to hear from our guests again about kind of their experiences with data and sort of how they've been able to make that health argument really stand out and help shape processes through that. So we're going to ask that Avtar kind of share a little bit about her perspective as a public health professional. So Avtar, what role were you able to play in helping people see the connection between planning and health?
Some of the things that we absolutely talk about are access to healthy food. So when convenience stores or access to supermarkets are laid out in a city, how does that affect somebody's health and access to good quality food? In terms of that, we also talk about walkability. So if somebody needed to walk to the grocery store and they live from point A and point B to the grocery store is maybe 2 miles, we talk about issues of how convenient is it to walk versus drive, or in an environment or in a community if somebody didn't have a car, what would they do? So some of the things we always look at about health is I try to tie into some of the things that I think are going on in the community right now. And those, when we're looking at the obesity epidemic, one of the things we're looking at is the ideas of food deserts versus food swamps and the ability and access and how transportation also plays into that.
Great, thank you. So John, I just wanted to ask you about your experiences in the Arvin General Plan and in your other planning processes that you may have been involved in. But what are the sort of health issues that came up specifically during the Arvin process, that came up during the assessment process that were most surprising to you as a planner?
Well, I think we did prepare some existing condition studies that looked at what some of the health issues from the county level and the regional area. But as I mentioned before, the people are more interested in what happens in their community and in their immediate neighborhood. And one of the things that really popped up was we kept hearing over and over was pedestrian safety. And although pedestrian safety alone can be included as part of the safety element, but there are other parts that we can also address, and that would be providing pedestrian access to and from various locations. And one of the things that was really important was parks in their community, and looking at where the parks were and how residents from one area can go to the parks. And so what we did was we mapped out all the parks in the area and all the high-density residential areas and showed that where there were pockets of where it was not accessible to the areas of parks. We also looked at vacant lots and the use of vacant lots for infill development opportunities. And one of the things that really came out was residents wanted to be able to use those those vacant lots for recreational purposes. So we included a policy in the general plan to have temporary uses of vacant lots where the surrounding neighborhood would take care of the parks on a temporary basis. So if development were to come in, then that would then be used for whatever the proposed development is. But until that time, it could be used for a park. So,
great. That's really a wonderful example of the way that you've been able to kind of combine the data collecting process with resident feedback. And I think actually both you and Avtar kind of really spoke to that idea of really having the data, but also including opportunities for people to respond to it and to highlight what their most important issues are in terms of health. So we're going to switch gears again and get really into the policy development process.
Thanks, Lisa. And I also want to say that was a perfect transition to talking about policy, because the process John just described, where they brought data to residents, got residents' feedback on that information, and then translated that into a policy in the general plan, is exactly the process that we talk about creating great policies. So here we are looking at our overview of the plan development process again. And we're looking at sort of the second half of this process. So we've moved from our initial resident outreach, our initial engagement, and our look at existing conditions into actually translating all that information into a set of policies. And the public health roles in this process are really important. So that can include things like drafting or commenting on draft policies, looking at ensuring that health data is actually included in those policies as they're developed, and facilitating community engagement in either choosing land use alternatives or providing feedback on draft plans. Those are all very important roles. This resource I want to just highlight for everyone is how to create and implement healthy general plans, and it's a toolkit that you might find helpful in the plan and policy development process. So it provides guidance on creating healthy land use plans at each step of the process, from relationship building to data collection to policy development and ultimately to implementation. And it also has a section with model policy language for a range of health issues, including healthy eating and active living, as well as other issues like air quality, housing, and mental health. In addition, ChangeLab Solutions has developed a collection of policies that support health from California general plans, and this came from adopted or public draft documents, although I would say it's actually quickly being surpassed by some innovative plans that have been adopted even in the last year. But it's a great resource and reference guide, and it includes language for a healthy general plan that might come in many forms. So it might be a standalone health element devoted to the topic. It might be language that's interweaved throughout various other elements of the document, such as land use or transportation or circulation, or it might be a combination of both those strategies. So having a standalone health element and cross-referencing other relevant areas of the plans. It may also include both overarching guiding principles or goals for the plan, as well as specific policies and actions. So it can be both that high-level framework as well as the specific ways that you're going to move forward and take action in a community. Policies can support healthy changes to the community without directly addressing their health benefits. So in other words, they can be health implicit, or they can provide a health context to clarify their purpose and significance. In other words, being health explicit. So just to give you an example of that, you might have a policy that promotes walkability without referencing the health benefits that it would have in terms of increasing physical activity among community residents. And if the policy is implemented, you might have that health benefit anyway. But the policy could also be written in such a way that it explicitly describes how the intended effect of that policy is to affect physical activity. And you see examples of both of that, although I would say that health explicit policies are becoming more the norm. Policy language with explicit health language is likely to reflect two important community characteristics. So the first characteristic is the capacity of both health departments and community organizations to advocate for and eventually watchdog land use policies that promote health. And the second is an understanding on the part of elected officials and decision makers that land use policies have an impact on health. So those community characteristics I think are really key when you think about drafting policy language that explicitly promotes health. I want to give you a few examples of policy language to just sort of illustrate the point of how even policies that generally benefit health can be improved by thinking about a few key characteristics. So here I have two policies promoting opportunities for regular physical activity. And if you take a minute and look at the first one, you can see it's a generally positive policy. But there's a difference between the first one and the second one in that the second one actually sets a standard for residents' access to very specific kinds of community amenities like daily retail needs and nearest transit stops. And that second policy, while it is getting at the same overall issue as the first one, is a policy that spells out in much more clear language what the intended community effect of that policy is going to be. I've got another example here about developing access to healthy foods. So the first policy talks about using community gardens as a way to increase residents' access to healthy foods. The second policy, and this should be a theme for you all now, actually looks at establishing a standard for one community garden for every 2,500 households in an urban village or an urban center. That's from Seattle, Washington. And Seattle uses this urban village concept as a planning concept. It's essentially a neighborhood scale for them. The idea here is that rather than just saying generally we want more community gardens, they're setting a specific standard that will allow them to not only look at who's meeting that standard now, but prioritize resources in the future and really target those neighborhoods that lack access to community gardens and other sources of healthy food for any future investments and new garden development. So let's look at one more example of policy language. This is from Watsonville, California. It's a small town on the Central Coast. You can see that they've included in their general plan a policy to promote healthy neighborhoods and community by encouraging neighborhood convenience stores to carry healthy food. And I think this is a great policy that shows that connection between community access to healthy food and land use plans. They also have included an implementation strategy. That is, they're going to use conditional use approval to condition neighborhood markets at the time of their development review to incorporate the sale of fresh fruits and vegetables. So they're not only setting out that policy as an overarching goal, they're also coming up with an action item for implementation. Now I've gone ahead and rewritten this to take it one step further. So this is my edit to Watsonville's policy to provide a little more clarity about that implementation mechanism. So I'm not suggesting that this 10% number is the right number for all communities, but I do think it gives the policy something clear and measurable and helps achieve the outcome the community wants. So the idea here is that a store offering 3 apples and a few old potatoes, they might meet this kind of general test of incorporating sale of fresh fruits and vegetables, but they're not really doing, they're not really taking on the kind of business practices that probably the community wanted to see when they put that policy into place. So that's just a sort of creative way to start thinking about policies from the perspective of, well, how do we know who's meeting this standard now, and what do we need to do to make sure that we actually achieve the goal that we set out in the policy? We've talked a little bit about the idea of having a separate health element versus integrating health throughout other elements of the plan, and I think that there are different opportunities that different communities will take, and each place needs to really choose the approach that's right for them. So some things to think about if you're trying to decide where health should really be located within your plan. One thing to think about is about visibility. A lot of health advocates like the idea of a separate health element because it really creates visibility for health and a platform for health that might not be quite as prominent if health is simply integrated in other areas of the plan. Another aspect to think about is usability. So who's actually going to be using your plan going forward? If you're talking about a developer using this plan, they might not necessarily look for policies related to, let's say, traffic safety in a health element. They might be more oriented towards thinking about the circulation element as the sort of guiding area of the plan relating to those topics. So if users have a hard time finding the issues that they care about within the organization of the plan itself, that's just something to keep in mind. A few other key points to keep in mind are around cost and implementation. So Lisa talked a little bit about scoping plans and thinking about including health in that scope right from the very beginning. But if you don't actually have that opportunity to come in quite so early in the process, it may be difficult to tack on an additional element into a plan that wasn't originally budgeted for, and it might be more cost effective and efficient to instead look at what's being developed under the existing scope and really fit health within that framework. The last thing that I would just point out here is whether all existing health issues could fit into a more traditional general plan framework. So this image right here is actually from Richmond, California. It's from their draft community health and wellness element. And you can see the diversity of issues that they're addressing within that health and wellness element. Everything from issues related to circulation, to issues related to economic development, to housing, to healthy food, really a very broad spectrum of things. Many of these might find a home within another element, but perhaps not all of them. I think access to healthy food is one of those that often doesn't fit neatly within one of the 7 mandated elements, so there might be an advantage to having a separate place for it to live. So we're going to go back to John and Avtar and ask a few questions again. And John, I actually wanted to start with you. So I wanted to ask you a little bit about some of the challenges you've faced in developing the language of the plan and how you've overcome them.
Well, I think the major issue is consistency of policies and actions within the various elements of the general plan. In the case of City of Arvin, the community health element is done separately, and it's important to look at the timing of that because it'd be great if all the elements in the general plan can be done simultaneously. Unfortunate because the current budget situations that are facing a lot of communities, certain elements are done ahead of time, and so in the case of Arvin, we're doing the land use and the health element together, as well as the air quality, but some of the other elements may come at a later time. And so that's where our challenge is making sure that the policies we are recommending also coincide with policies that are currently existing in other elements, and that recommending other changes to or amendments to other elements of the general plan. I think
that's really interesting, and I am hearing more and more communities taking that exact same approach where they're not necessarily doing a wholesale plan update, but instead are tackling individual elements one at a time. And I wonder, was there any specific example of a policy that you realized wasn't necessarily in conformance with other areas of the plan and you needed to make recommendations about amendments or adjustments around?
Well, I think it'd be the land use and the circulation element. I think circulation, many communities are just now getting into some of the sustainable growth type of principles. And in some communities, their general plans are 20, 25 years old. So I think that's where some of the conflict or some of the challenges are between circulation as well as with land use and community health.
Yeah, it really gets to the heart of that, maybe not necessarily a conflict, but the approach where you're really looking at primarily serving cars versus thinking about other users.
Exactly.
So Avtar, I want to ask you a question about implementation. So I gave some examples of policies where I gave kind of the good and better version, really thinking about drafting from the standpoint of moving towards implementation. What have you observed in terms of challenges and opportunities of actually implementing policy language? Is it in the drafting, or is it something else outside of that?
So I think what happens is in a couple of the cities I work with, beautiful policies get written to promote health, and it gets hard sometimes to convey to the public of how those policies get implemented. So one of the cities we worked with was the example of bike lanes and biking. So policies written in the circulation element to promote more of non-motor vehicle transportation but biking. And then when people at the city saw that bike lanes were going in, and I guess it's Public Works who were making the lines and showing that we're making space in our streets, I guess putting the streets on diets. I think some of the residents saw that as like, this is a great example of how we gave feedback, and now they took our feedback, wrote into policy, and implemented it in a way that we can actually use it for our families. So in the city of Arvin, as we go through with a lot of the community resident feedbacks and taking their data and making it into policies, I hope in the years to come that we will see, well, one of the examples we're working with John is one of the residents have said that this is an area we'd like to see a healthy corner store come in, and so John and I talked about how do we take their feedback and him writing language around zoning for healthy retail or healthy corner stores, and then bringing that to the city council and saying, can this be an opportunity to bring in good, healthy retail in this area?
Yeah, that's such a good point, and I think I actually recently heard an elected official talk about a plan using very similar kind of language that you just did, which is we had this great plan, beautiful policy language adopted, but I'm struggling with implementation. And I think what you just described of striping bike lanes is a perfect example of something that's actually relatively low cost that can actually happen within a relatively short timeline. And I use that word relatively just because even small-scale street infrastructure improvements can have cost and time implications, but they're doing something that at least can happen within a resident's kind of experience memory of participating in a plan process where they see a tangible outcome. And I think that that actually probably is one of my other key aspects of having policy that in fact does support healthy communities, is that there's something in that plan that can result in relatively short, low-cost improvements. So I want to end this segment by talking a little bit about some key thoughts, key considerations to keep in mind when integrating health into land use plans. So the big idea here is what makes a good health policy. So the first one is about whether or not the policy reflects the community's vision. And I think that's something that those of you who are out there who are involved intimately in plan update processes need to ask yourself and need to reflect on, and thinking about, was a broad and diverse set of stakeholders really involved in identifying needs and really pinpointing what issues policies need to address. The second is about including locally relevant health data. So can you identify those benchmarks related to existing conditions as well as standards and targets and goals for future conditions that it can actually reflect existing health and built environment data. The third is around implementation, and that's just such a key and recurring theme. So do those policies identify actions and programs like updating zoning codes or securing funding for an infrastructure investment that will guide us from vision to action? Do the policies name implementation partners so that local government agencies in the community know who will play what role? Those are all important questions to ask about implementation. The next is around success. So how do we know if the policy has actually been successful? Are there identified standards or targets that can be measured to highlight where policies have achieved a vision and where they may need to be reworked in a future plan process? The last is around health disparities. And the question to ask ourselves is, does the policy make progress towards eliminating health disparities? Does it specify that underserved, low-income, or communities of color receive priority for funding or for infrastructure development? And there's some important strategies that communities are using to be able to kind of think effectively about using their policy-making process as a way to really rectify some of those health inequities in communities. And by the way, you can find this list of consideration in the publication I mentioned earlier. That publication was Healthy Planning Policies, a compendium from California General Plans. So just to revisit this plan process diagram that we've been taking a look at throughout the course of today's training, hopefully today's discussion has given you all a lot of great ideas about how to incorporate health into each step of this planning process, all the way from project scoping through policy implementation. And I also want to especially thank our two guests today, John and Avtar. I think they're a wealth of experience and knowledge on healthy planning processes, and we really appreciate their time and their feedback. So with that, I'm Heather Wooten, and I was joined by Lisa Chen. This is our contact info. We're available to answer questions about any of the stories or resources you heard about in today's call. You can always find us on the web at changelabsolutions.org. And just as a reminder, today's webinar was for informational purposes only, and it does not constitute legal advice. So thank you all so much for joining us, and we hope to hear from you soon. And good luck with all those healthy plans out there.